violinist still making music after DBS surgery, Mayo Clinic. So, in the UK, musician Dagmar Turner played the violin while doctors removed a tumour in her brain. Thanks to this, doctors saw areas that did not need to be touched. 7 years ago, a professional violinist had a seizure while playing the violin. She could not control her hands properly and began to feel bad. A thorough medical examination showed that a small glioma of the second degree, a malignant tumor, was formed in the frontal lobe of the woman's brain. Turner explained to her surgeon, Professor Keoma Ashkan of the Royal College Hospital in London, that she was afraid of losing her skills after the operation. The doctor promised to figure out how to avoid complications during the operation and, together with his team of neurosurgeons, began drawing up a thorough map of Dagmar's brain to determine the areas responsible for playing the violin. Despite the long and painstaking work, doctors still have doubts about the accuracy of the practical implementation of the planned operation. Then they had the idea to take the violinist out of anesthesia during the operation and hand her the violin in order to see in real time how her brain responds to direct influences and avoid damage to important areas that control Turner's subtle movements. The woman agreed. Anesthetist and a psychotherapist closely watched the woman and prompted the surgeons when their actions began to affect her coordination. The procedure turned out to be very complicated, because it required scrupulous accuracy down to the millimeter, but everything went perfectly. 2 weeks after the operation, the woman was already performing again. Dagmar did not expect the operation to end so successfully, and she did not need to relearn to play her favorite instrument.